Hey everyone, this is our last topic for this semester's Issues in Healthcare class, easy for me to say. We're talking about Medicare, Medicaid, we're going to be talking about universal healthcare, some issues with COVID that's come in with some of the articles I posted, and then thinking like more broadly off the top here about like what is healthcare, and what is health insurance and who should have it and who needs it. So these are questions I want you all to kind of think about, so you can pause or go back and look at these questions again for your reflection about who needs health insurance. Everyone, only sick people, young people, old people, who needs it? How do you think right now, this is a good place to pause, right? How do you think right now that most Americans get their health insurance? Do we have a universalized healthcare program? Do we have a state-run healthcare program? Do we all have private insurance? What do you have? How does this work? And this last question will hang out there as well. It's another good pause one for your reflection is healthcare a privilege or a fundamental right? And so there are differing opinions on this. I posted a few resources as well to help you with your reflections too. So we want to think about those questions as I go here and give you a really kind of quick 15-minute overview of kind of health insurance and how things work. There's that question again, so you can hang out there. If we were in person, we would be doing this question. All right, so let's look and see some of the answers to some of these questions. So if you didn't answer it yourself, pause it and go and write your answers down and then come back to the slide. So this is looking at kind of a recent, like last 20-year shot at the percentage of adults who were uninsured or had private or public coverage. And so you can see like up here that from the 90s through today, that there was a large portion, between 70 and 75% of folks that got insurance through the private market. And so a lot of those individuals are getting private insurance via their employer. There's a large portion of individuals that were uninsured. So we go back to like to the late 90s, we're seeing the uninsured numbers that are hanging around 20%. So again, for those of you that are not math majors, that means 1 out of 5 Americans were uninsured. That's 20%. All right. And then about 10% of folks were on a public insurance plan like Medicare or Medicaid. That's what we're going to be talking about here in more detail. You can see that there's this inflection point here, right? So this is where the Affordable Health Care Act was passed, also known as Obamacare. And so now we have this flip, right? So we see the uninsured rate go from like around 20% or so down towards 10, 11%. And thus, consequently, there's an increase in both individuals on private plans. We see an increase in private insurance, and we see a steady increase in those on public insurance plans as well. So we'll explain how both of that happened. All right, so when we look at that, like what do those numbers mean? That again, 1 out of every 5 Americans being uninsured was where we kind of started with. Now that equates to about 27 million people of all ages were uninsured, and that rate is decreasing. The Affordable Health Care Act has allowed that to decrease. All right. Importantly, the percentage of uninsured children has dropped dramatically from the 90s to the late 2010s, right, which is when we have data for. And again, that big increase in getting Americans to have health insurance from a public program. It's a state-run, government-run program. So what are these public health insurance programs, these state-run programs? So our big ones are Medicare and Medicaid. And I'll talk about how the Affordable Health Care Act influences those programs towards the end. So we're going to start off with Medicare first. So Medicare is this single-payer, government-funded healthcare program. So this is when we think, we'll talk about universal health care in the next lecture, but this is kind of what folks think about, this single-payer government-run healthcare program. All right, it's funded in part by payroll taxes, and it's for elderly adults. So the majority of folks eligible for Medicare are 65 and older. There are some provisions for disabled Americans, but that's going to be more for Medicaid, as we'll see. And so in 2015, 55 million people received health insurance via Medicare. Now, this is an incredibly complex plan, and there are many different parts. There's parts that pay like hospitals, parts that pay clinicians, prescription drug plans. We're not going to go through all those kind of details here. I just kind of want to give you the basics that Medicare exists. It's for elderly adults, and it covers a lot of people. 55 million people or more. All right, so what does it actually do? How does it actually help individuals, right? So it's going to cover about half the cost of medical expenses. So it doesn't cover everything, right? So if you're over the age of 65 and you're counting on Medicare to like cover all your needs for healthcare, it's not going to happen. Most seniors have to purchase supplemental insurance out of pocket or through a private marketplace to cover some of these costs, right? The costs for Medicare include things like premiums, deductibles, and copays. So a premium is still saying that if you're 65 and older, you are still paying a monthly fee for your health insurance coverage. It's not all free, right? The government is subsidizing the health insurance. It's not paying for it totally. All right. There's also what's called deductibles. And these terms all apply to private health insurance as well, right? A deductible is how much you have to pay out of pocket first before the insurance starts paying. And so you've heard these terms of like high deductible plans or low deductible plans. A high deductible plan might cost a little bit less per month, but they ain't going to pay nothing unless you've already kicked in $5,000, $10,000, right? So you got to have a good nest egg there to begin with. If you're paying for a cheap health insurance plan, you likely don't have that, and you probably just get screwed. And coinsurance is like your copay, right? So after the deductible has been paid and met, how much are you still paying for the overall cost? So a copay or coinsurance might be like a small fee that you would pay when you go to your doctor for like a family doctor a visit, and maybe you pay a $20 copay for the visit. All right, so Medicare we saw, it's for elderly adults. It doesn't cover everything, right? It covers a portion of their healthcare costs. Medicaid, these similar names are difficult. It's a government-run healthcare program. What's different about Medicaid is it's actually administered by the state, right? So all states now have this. At first, not all states did, and because each state administers it, there are subtle differences in eligibility from state to state to state. So that means an individual might be covered by Medicaid in one state, they might move and lose their coverage, because each state gets to determine what those eligibility levels are. In general, the eligibility is set at low income, right? So individuals that are deemed to be low income or disabled. We'll go over Michigan's plans here in a little bit. So we saw Medicare covered over 55 million people. Medicaid covers over 70 million people. The large portion of those are children via the Children's Health Insurance Program. And in Michigan, the eligibility is for individuals that make less than 133% of the federal poverty level. So that's approximately, these change each year, approximately $12,000 or less for an individual, or $25,000 or less for a family of four would make you eligible for Medicaid. Okay, so how does the Affordable Health Care Act play into all of this? The biggest impact in terms of getting individuals covered by health insurance from the Affordable Health Care Act is expanding coverage of Medicaid. This is overwhelmingly the biggest path to getting more folks health insurance. So it expanded coverage of Medicaid, and it allowed states to determine if they wanted to expand their eligibility or not. All right, so each state got to choose if they're going to expand their coverage or not. And so we saw a lot of states kind of follow like party lines, whether they were Republican leaning states or Democratic leaning states, about whether or not they actually increased those Medicaid rolls or not. And there's large financial implications there, right? The federal government kicked in and helped out with all those costs up front. But then in this bill over time, they're going to decrease the federal payment. So the states are going to be on the hook for more and more costs over time. All right. This actually changed due to COVID. And there's a nice article that I posted up there about how the COVID Relief Act changed this and kept the federal government on the hook for more of the costs long term. All right. So the states in like a darker green are the ones that immediately expanded Medicaid. So Michigan was one of them. And I do want to point out that Michigan was under Republican Governor Rick Snyder at the time. And Governor Snyder expanded Medicaid eligibility. So it's not a straight Democrat or Republican thing, although In many cases it was. Some of these states now have come around and did expand Medicaid, like Oklahoma has, Wisconsin has, a few others. These were the original adopters of the expanded Medicaid. Again, just the whole idea is that by expanding Medicaid, you're getting more of your citizens' health insurance. Okay, so we're going to talk about Michigan real quick here. So Michigan's Medicaid program is called Healthy Michigan. So if you've seen these Healthy Michigan signs around, that's what we're talking about. So the Healthy Michigan level that's been expanded through the Affordable Care Act now sits at a family of 4 with income below of $33,000 a year or less. All right. And so Michigan's uninsured rate has dropped massively over the last 10 years. It's had a positive income on getting individuals insured. And we kind of fall towards the middle of the pack about our uninsured rate. So if we look at 2018 data, in Michigan, 3.4% of children were uninsured. And the best in the country is Massachusetts. Massachusetts has a very, very strong state-run program, some of which the Affordable Care Act was modeled after, whereas Texas is the worst. And for adults, 6% of adults in Michigan are uninsured. And again, Massachusetts is the best, and Texas is the worst, with 20% of adults in Texas being uninsured in 2018. All right, there's all kinds of legal stuff. You can click on some of these links and check it out. But folks have been fighting against some of these expansions since they were put in place from the Affordable Care Act. We're not going to litigate all that kind of stuff here. In 2020, the Michigan legislature passed a plan that had a work requirement tied to the Healthy Michigan plan, and blah, blah, blahs. It got overturned. And it's appealed, right? So one of the fun things about some of these health policies is we really got to stay up on top of these things. This is the field y'all are going into, and it's a fast-moving field with a lot of litigation and politicians, everybody's favorite. Okay, last 3 minutes here from me. I'm going to keep it quick. There's a couple good graphs I like here from MLive. This first one is showing the percent of Healthy Michigan recipients based on congressional district. And you can see which areas of Michigan are more or less reliant on Medicaid, right? Medicaid, again, being for low-income individuals or disabled individuals. So we see that some of the congressional districts around our area here, Metro Detroit area, Flint, heavily reliant on Medicaid, but also a good amount in more rural Michigan, northern Michigan. We can see this data here as well. I'm going to move this down. We're looking at percent of Michigan births. So in Michigan, Medicaid pays for 44% of Michigan births. This is from 2017, so this is older data, but it's really an interesting case study. And what I like to see here, to show you here, to point out is that this is not a rural-urban problem with Medicaid, or meaning that individuals that need assistance getting health insurance. We do see our large urban centers in the state, whether it's Grand Rapids, Detroit, Flint, having high percentages of Medicaid paid births. But if you look in northern Michigan, in the Upper Peninsula, a lot of counties in there are the max range or the second highest range of percent of the population paid by Medicaid. And if we look nationwide, right, we can see some really troubling numbers that illustrate some of the issue here. So we saw these kind of troubling numbers in Michigan. Michigan actually falls in the lower end of the pack. A lot of states in the Sun Belt in the South are heavily reliant on Medicaid to pay for births, right? So that means of all children born in Alabama or Georgia or Mississippi, right, that 54 to 72% of those births are paid for by Medicaid. So this Medicaid program that is supporting low-income Americans is of high need, right? I think these last two graphs really show the illustration of how challenging this question is in our country, and how important this idea of healthcare access and healthcare privilege versus a right really is.